Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of our show, bringing you another really fascinating guest today, involved in creating a better tomorrow for so many people out there. Today, we have the honor of being joined by Dr. Keith Sumption, who is the Chief Veterinary Officer and leader of the Animal Health Program at the Food and Agriculture Organization of the United Nations, where he also serves as their director of their Joint Center for Zoonosis and Antimicrobial Resistance. Dr. Sumption has worked on disease ecology at the interaction of wildlife, domestic, and the environment for more than 30 years. He holds his Ph.D. from University of Reading, where he did work for over 3 years in the field, as well as in molecular epidemiology research on African Swine Fever in Southern Africa. He also has his veterinary medicine degree and natural sciences degree from Cambridge in the UK. And he previously served as executive secretary of the European Commission for the Control of Foot and Mouth Disease, where he's been responsible for developing strategy, negotiating funding, and managing implementation of their commission's work programs, which now involve over 80 countries, and reports to the member states of the commission and the FAO Regional Conference and Department for Progress. Prior to the FAO, Dr. Sumption was a regional group leader and master's program coordinator at the Center for Tropical Veterinary Medicine at the University of Edinburgh, managing a range of projects there on African high-impact tick-borne and contagious diseases, including heartwater, filariasis, mycoplasmosis, and viral transboundary animal diseases, and is a seconded technical officer at the United Kingdom Department for International Development, leading work to ultimately define demand and impact of research at the primary animal health care level in Kenya. And just as a review, the FAO of the United Nations is an international organization that leads efforts to help defeat hunger, improve nutrition and food security, has close to 200 member states and governments involved in various programs. We're honored to have Dr. Sumption with us today, though. Dr. Keith Sumption, thank you so much for taking the time to come on the show.
Thank you. A real pleasure to be here.
It's great having you. I would really like to start off, as we typically do, by handing you the floor for a few minutes, just to talk a little bit more about sort of the development of these initial interests. Because, I was reading through, well, not reading through all of it, but I was looking at your PhD, where that was entitled Genotypic Comparison of African Swine Fever, Virus Isolates from both Zambia and Malawi. But in addition to some of those field studies, you were also in the early days, studying foot and mouth disease, some interesting gram-negative cockle bacteria known as Ehrlichia ruminatium, a lot of different livestock diseases here. What got you interested in sort of this segment of animal health in the first place?
Yeah, no, nice question. Thank you. Well, I grew up in a farming family in the west of England. Livestock were there. When I went to do my studies in Cambridge, I had no idea just how interesting so many of these sort of related areas would be. And I first looked at something called myxomatosis, a plague of rabbits, which had changed the ecology of Britain and Europe. So it was so one virus could actually change the ecology of a country through wiping out one of the major herbivores. So that was when I was 19 who did this. So fascinated by that interaction, really, by how these things, these epidemics, can change the ecology, but also the ecology changes the likelihood. So when I was a student, I went to Zambia and Malawi, and got immediately out into the field where you realize that something like African swine fever had been going on for a century, and it was still little understood. That disease has become, from Southern Africa, has become one of the world's biggest problems in livestock production. And there I was in the field, puzzling over ticks, over warthogs, the role of wild boar, the role of social trends, such as the way that people keep their animals in seasons. Everything is connected, everything from the seasonality of production through to the likelihood of spread. Fascinating. So got my chance to do a PhD in the same sort of area. Again, it sounds, really, really detailed stuff, but it was the first work really on characterizing this pathogen and realizing how much it was different from one warthog burrow to another. And out of that whole ecosystem, things spread. So I got interested in vectors. How are they involved in maintaining disease? How are they involved in spread? So my work in the tropical center was largely to do with everyday problems of livestock keepers, which is essentially, in many countries, their livestock are deeply affected by daily burden of ticks and helminths and other things, which we don't really think about, but they do, and it matters to them. And it matters to keep them alive. So that's when I worked with the UK government in Kenya as an epidemiologist, understanding what people do on a daily basis to control disease. And that matters when we talk later about antimicrobial resistance. And all these things come together because in the end, what people do with their animals affects not just their livelihoods, but other people who keep animals. And so our role is really quite fascinating, I think, in terms of trying to work with nature, but also work with human nature too.
Excellent, excellent. And yeah, as you were talking about, obviously this theme of it all being connected, and okay, your initial work was in South Africa, and you saw obviously the relation, across some of those countries in the South, but now obviously your purview as leader of these really three connected programs at FAO is quite broad, in the sense that I mentioned in the intro, you have close to 200 member states of the organization that have issues to deal with along these lines, and then you are working at this fascinating intersection of animal health, zoonoses, and we'll get into spillover in a little bit, and then obviously, as you were just saying, antimicrobial resistance, another major issue. We just had one of your counterparts at WHO, Dr. Gedehoon, on sort of talking about the quadripartite program. Talk about your role a little bit at FAO. We had Dr. El-Wafi on last week talking a little bit about drought-resistant wheat and interest in cultivars and things like that. Again, your purview are livestock and a variety of other animal species. Talk a little bit the roles, how they intersect, and a little bit of where your directives come from. I mean, if there's a problem in Brazil and one in Indonesia, and how your day is laid out to focus on some of these global but interacting problems.
Yeah, no, thank you. So my role as Chief Veterinary Officer is really to sort of lead the animal health work. So animal health here includes the consideration of what the connection between wildlife, their health, and those of domestic animals, and the health security side that might come from potential spillovers. So the animal health program traditionally really thought, go back 40 years, it was really about food security mainly, and the livelihoods of those people, the hundreds of millions who keep livestock as part of their daily livelihoods. But with the emergence of zoonoses, of pandemic importance from animals, so that means that we really have to track those emerging epidemics and be aware of where they can come from as part of our work. So our daily work is really is scanning and forecasting what might happen next, responding to requests from countries for assistance. For example, the many requests now for assistance relating to avian influenza around the world. Those things come in and we will respond to them. We have a system to be able to do that. They may be disasters that essentially need a disaster response to be able to manage. But we're also trying to say, what are the root causes of some of these things which are emerging? What are we doing in terms of our assistance to countries to be able to prevent, as far as we can, the emergence? And that's potentially hard because hundreds of millions of people keeping livestock, you will not change their habits. We can't suddenly put masks on to animals to start controlling their epidemic. So very much working with the livestock sector to be able to look at what things are feasible to do, what investments would be needed. So the other part of the work is the One Health, as we call it, which is recognizing the health of animals, plants, the environment, and people is all connected. So my role in the house is also to lead one of the 20 priority areas of FAO, which is One Health, considering that plant health, forest health, insects, and their biodiversity, all of those things are actually one part of a healthy production system. Across the house, many different experts who are supporting countries. But under this one umbrella, we sort of see that there are many common themes, and we can better support risk forecasting, prevention, response, in the same way that we have to do for animal disease. We also need to think of and include and support those efforts for a much wider range of risks to our production system. So that's a kind of coordination role. And then finally, just I didn't mention it, but we also work very, very closely on a daily basis with the quadripartite. So that is with WHO, with the World Organization for Animal Health, and the UN Environment Programme. We have a joint plan of action, and the intentions there are really in working together is to support countries to give a more integrated approach at country level that is less biased to the health of any one part of that, but actually looks to how we can support the system to be strengthened to support health in multiple sectors.
Excellent. Keeping that theme going. Let's say we'll focus on zoonosis first, and I was looking at several of your papers in the peer-reviewed literature on the topic. You had this British Medical Journal paper from 2021 entitled "Preventing the Next Pandemic: The Power of Global Viral Surveillance Network," and obviously, okay, I mean, we are coming out of COVID. As that has been happening, other things have bubbled up along the way, whether it's been monkeypox, and you just mentioned H5N1, of course. And one of the core learnings here is the need in bolstering resilience for this global risk-based multi-sectoral viral surveillance network that would focus on, as you say, high consequence viruses, both in humans and animals, and in these emerging hotspots. And it's interesting because we've had sort of a range of guests on the show, talking about their strategies in this area, from focusing on the hotspots where we think it's highly likely that stuff's going to pop up, to programs like the Global Virome project, where we know there's millions of them out there, and we want to catalog a lot of them because a decent percentage of them could be pathogenic at some point. What is your position on this? Where does FAO stand in terms of developing this broad surveillance network to, God forbid, pick out the next COVIDs before they pop up on the screen?
Yeah, I mean, we thank you. So I think we absolutely recognize that there is a huge biodiversity of viruses that will intersect or will infect a range of hosts of relevance to us, and that is in the animal space. It's includes livestock, wildlife, fish as well. So there's a huge diversity out there, and we have traditionally as organizations we've dealt with problems when they pop up and emerge, but we don't deal with or better prepare for that pre-emergence stage. So as an organization, our scope is really working with international partners to be able to say, when we do our role in livestock and in the environmental monitoring, when we support countries to improve their surveillance systems, they will find things. Those things have to be compared to an international database. And multiple times in the last few years, things have emerged, and they're not always captured in a database because there isn't something that's very close to them which has been fully characterized. So even if we are able to say we've got a good match and we know what this pathogen is, it's a long way from then being able to say what would be the likely transmission in all the species we deal with. So we're very dependent on those functioning systems, laboratories, universities who are putting information into the public space, to enable this global viral work to take place. So it's important. We work with WHO in relation to early warning, and they have with the International Pathogen Surveillance Network trying to improve the way that virus sequences are shared and are able to be characterized. But one of our difficulties always will be we may get the sequence because that's relatively easy, but the characteristics of that pathogen are not easy to predict, even if things are getting better. And we can take that with SARS-CoV-2. The sequence came out relatively quickly. Then after that, how do we predict the infectability of that virus and transmission through all the hosts that we're dealing with? And so global virome, it's one part of that whole library approach that we need, because we do find new things that we're not sure what they are really quite often, and we need to be able to compare them to something. So our role in many ways strengthening national systems for laboratories in a more integrated way. That's important because those things might happen first in unknown syndrome or misdiagnosis in the animal population, could be important. We're also very conscious that there's a need to connect animal and human data in the same countries. So if you have a mystery disease in animals or in humans, are we looking on the parallel to see, where is it coming from? What's the source? So that needs a interoperability of animal health information with public health information. So we're working on that. That's something that within our program is to really strengthen that public health, animal health information system capacity at country level, so that national investigators could more quickly work out, is there an animal source? How big is it? What is it? What might it take to control it? But in an integrated way, breaking down those silos. So that's one whole part of it. But capacity to do these things, although COVID has really pushed capacity development in almost every country, so that we can now talk about variants of COVID that most countries can pick up variants because they've got some capacity. That capacity might be limited if you had, let's say, a whole lot of other things to look for, but capacities have really come along in the last couple of years. Things like wastewater sampling, where now you can take water from the public sewerage system, and you can find almost as much data as you can from other more patient-oriented testing. That way enables more of a screening of a population. It's going to find, if we start doing that, we'll find huge numbers of hits of potential pathogens. What are they? Are they important? Does it matter? So we've come into an area of big data, and we need to have those references from virome characterization to be able to say this much is normal or this is abnormal. So very much an evolving area. Capacities are not equal everywhere. Risks are not equal. The countries we deal with, often because of climate, environment, water, sanitation, hygiene, they have higher disease burdens in animals as well as in people. So there's a lot of, there is potentially a need for greater capacity in those areas with greater burden.
Moving from zoonoses to antimicrobial resistance, you were involved in publishing the FAO's 2022 report, which was entitled Tackling Antimicrobial Use and Resistance in Food-Producing Animals, Lessons Learned in the United Kingdom. And you know, this report is quite interesting. It talks about this targets task force that was set up, part of the Responsible Use of Medicines in Agriculture Alliance, again, looking at antimicrobial stewardship and the sort of interesting sort of collaborative, voluntary collaborative approach taken in the UK. I was wondering if you could talk a little bit about some of the learnings here. Again, you know, thinking about antimicrobial resistance and proper antibiotic stewardship as a, in my case, a father, right? You know, I know, you know, there's points where we probably should think about, does my child really need an antibiotic? Again, when I'm dealing with a farm or sort of managing livestock, and yeah, I want proper antimicrobial stewardship, but I don't want, you know, 5,000 dead cows, or that's not good for my business. Talk a little bit about this really interesting sort of system that was discussed in this report and some of the learnings from the UK.
Yeah, I think so. I think we are in a world which is really threatened by the rise of antimicrobial resistance, and it is truly alarming. Not simply in terms of the mortality rates, which already place antimicrobial resistance as being, you know, the third most important recognized cause of mortality. This will continue to grow as an international problem, not simply for humans, although that's the obvious one that we're all worried about, as you've said. And it'll grow for several reasons. One being that finding an effective antimicrobials and bringing them to market is enormously costly, and we have a desire internationally to use far less antimicrobials. So we are then expecting our industry colleagues to work on the pipeline and bring new antimicrobials for a market that in many ways we're saying we actually want to use less. So there's a real risk that a few years down the line we will not have effective antimicrobials, and things that we take for granted now, you know, will not be treatable, and that is a real risk. So the span of looking at this says, where are we using antimicrobials, and by weight, more antimicrobials are used in livestock production than they are used in human medicine. Yep. So people say, well, why is that? Well, partly because the biomass of animals is higher than humans, but there's also other reasons why that we have grown to have a very high level of antimicrobial consumption, you could say, in parts of our livestock production systems. So people are right to question that. Internationally, our role is to ask, working with livestock plant production, what ways can we reduce the use so that it's appropriate to those, need for life-saving, for welfare for animals, for essential plant protection, for production purposes. So appropriate use is really very significant. That's what stewardship is largely about, saying, can we make sure we take care of these antimicrobials, only use them appropriately? So that requires somebody like you, me, somebody who's actually has some ability to choose over antimicrobials, to have more agency and be able to select what is appropriate. That's not always easy, because in human medicine, there's more testing for resistance. So we can say in this hospital setting, this is tested and it's susceptible to, so we can choose this one. But in animal settings, those laboratory services are expensive, they take time, and you need to make a decision quickly. So appropriate use is also about having access to relevant local information to guide you in your decision making. So that's not easy at the moment, as we've said, and many of those particularly in lower middle income countries have very limited guidance to go on. So improving that is very much one of our targets. Trying to ensure that data that's collected nationally from different sources is put together, and is able to then quickly help those prescribers to make a good decision. And when we've tried that in areas where, for example, the use of apps to help a prescriber make an appropriate choice based on what is the data for the country, that's been really an important new tool to help those individuals. So we have a global problem, but mostly it's about getting to the individuals who are making those decisions. Now, the problem is not always the prescriber. It can also be the pressure to utilize those antimicrobials. It can be a lack of regulations, so that antimicrobials are considered chemicals and not necessarily the all-important drugs that we need as lifesavers. So when individuals, livestock owners, fisher folk, and others who are producing in food production systems, when they're more involved, then they can take more choice. That's largely the situation. Now, can we rely on them making good choices and appropriate use? We have to think about the incentives that will work for them. Sometimes the type of good husbandry practices that will go alongside using less antimicrobials, they cost money to put into place. Some of them involve a behavior change to the way people keep animals. Treatment very often has been cheaper than prevention. It doesn't sound right, but it often is more available, whereas prevention, vaccines might not be available. They might be restricted because they're not in the country. They're not sometimes produced even. So trying to make prevention the thing we do, husbandry, good welfare practices, those are changes, and those changes are not simple to bring about. So the type of report we produced is really saying, what are those policy changes? What are those ways that work? And our role is then saying, well, how do we help countries to go along a similar pathway that will help them with their stakeholders to be able to set reasonable targets, achievable targets, pathways, and the types of incentive. If we do this, who gains? To ask a livestock farmer to change something for public health they could say, well, it's going to cost me, and I don't really want to do it because it's going to cost more than doing what I'm doing at the moment. But there are incentives that will bring people into to change in this way.
Outstanding. Coming back to 2021 now, another one of your papers that popped out at me, which I found extremely interesting and scary, to say the least, was this One Health Outlook paper entitled Informing Resilience Building FAO Surveillance Evaluation Tool Biothreat Detection Module to help assess national capacities to detect agro-terrorism and agro-crime. Now, these are themes that obviously to see the connection to One Health. We have not touched on these before. In this paper, you point out an interesting program that you had together with the World Organization for Animal Health and Interpol, specifically focused on Canada and specific sort of animal terrorist threats there. Talk about this issue a bit. I mean, we haven't with a major pandemic the last couple of years, a human pandemic, we haven't really thought as much about this side of things. But is agrocrime, agroterrorism, how popular is this? I mean, how concerned or not concerned should we be? And again, if you could link it to sort of the broader, again, zoonosis spillover technologies, I assume this module is somewhat related, but please educate us a bit on this.
Okay, thank you. I think that particular piece of work, which is coming to conclusion, but the overall area remains really important, not simply for us as FAO, but actually in the UN system. There's always been a concern about biological weapons, and that's one part of it. Now, biological weapons were often seen as being ones that would target the human population, but considering the economic impact of let's say not being able to move livestock products around the world because of a potential event, if there was an intentional release of a pathogen of high consequence, it could really affect trade, and it can affect stock market prices, and it could affect food security and so on. So there's a lot of reasons why that intentional or unintentional release of something that would spread and could cause very high mortality in livestock production systems or risk to human health, that needs to be taken seriously. So this project was global, and it was really to look at how do we improve the capacities of the countries we work with to detect such a thing. So if there was an intentional release of an agent into the livestock population, would we miss it for weeks because it might actually be a conventional looking kind of infection? So in other words, if somebody was to move an infection present in one country to a country that it's not in, we might think, well, that happens from time to time. But if there's a pattern of things that would go with it to suggest, actually, this was not a random event that happened by simply a poor level of border control, but actually was intentional, would we pick that up? And would we, by our lack of capacity to investigate, would we even, let's say, contaminate the agro-crime scene? Because we would, by veterinarians controlling animal disease, they frequently resort to euthanasia, disposal of the animals, which for an investigator wouldn't be a great idea because it would potentially erode the investigation of things that could be real national security issues. So that was really behind it, is how well do we work as organizations to prepare countries for what could happen, and intentionally or unintentionally through other criminal activities, because people do things not always with an intention, but it happens at the same time as there might be informal or illegal movements of products across borders. So would we pick it up? Would they pick it up? If our laboratories detected something unusual across the pathogen screening network,
Yeah.
would we release that information to those that need to know it quick enough that they could take action? Because it could be that it's simultaneous, that it's released in several countries at the same time. We will only know that if there's an international system that enables that kind of signal to be picked up and to be looked at. And then how would we manage as UN, as with our partners in World Organization for Animal Health, Interpol, national authorities, regional disease control. So we wanted to test that through exercises to see if we would, how are we doing at the moment on that front. So what we published was really an improved methodology that would assist countries to look at their systems to say, are we going to pick up those signals that this is unusual? And when we don't do this on a daily basis, it's something that we might mistake as just one of those things. Would we pick up and then properly involve the police or law enforcement, military sometimes, into the response if we really think that is an intended agrocrime event.
Right. Talking now about technologies and innovation, I thinking back to some of the shows that we've done. We've talked about a lot of tools that I think fit nicely into some of the themes that we've been touching on. Everything from the reduction in cost of these genomic technologies for doing a proper pathogen screening in the field. We've talked about issues like, in the area of antimicrobial development, can we look beyond the antibiotic to, say, drugs that target, say, virulence factors, quorum sensing technologies. And then we touched on some, I guess what would be considered a little more controversial topics. One guest brought up the theme of transmissible vaccines in animal health. We talked a little about the Hendra virus story in Australia, and the need to vaccinate the intermediary species there in terms of horses. Looking out, looking at technologies, or the ones that are here, the ones that are sort of on the horizon, what gets you excited in terms of some of these new tools, in terms of accomplishing FAO's mission, things that'll make your job easier, that make us all safer? Take us a little into the future of what gets you excited.
I think we've seen a huge set of changes put in motion, really driven in part by the COVID response. I mentioned one earlier, and that is the potential of using far fewer samples, but far more information coming out of it. So, for example, being able to utilize the new genomics technologies and sequencing options with wastewater or with samples which are collected in that enable pathogen screening at a far wider scale. Mm-hmm. So I think they have excitement because traditionally we waited for samples to come in, or someone has to go and collect them, or we have to wait for birds to be found dead in a lake to be able to test them. Now we have the potential to perhaps sort of have a more routine collection from markets, from lakes, from animal collection centers, animal markets included, abattoirs where animals are passing through, and bring those into the system to be able to build up the understanding. And that potential is there, and antimicrobial resistance has been driving some of this because there we have contaminated environment from animals which have been treated, or from hospitals and their discharges, or even from the factories that produce antimicrobials. But we can now look in wastewater or water and streams to pick up a whole range of things. So those antimicrobial resistance genes, one thing,
Yep.
pathogens, another. So that's got a huge potential. But then, people will say, what if? Okay, so you get a sort of massive information. You've now got a better handle on what is a typical level, day to day, month to month, of a particular pathogen. So we have a better idea of population burden. We might be better at picking up very rare events at the start of something that could be significant, such as a new threat of human respiratory disease, for example. So are we going to get better at being able to scale our ability to turn that into a potential new vaccine? So I think there's a great race on and great pressure on to say, can we reduce what we did at the time taken in COVID down to less than 100 days to be able to produce and get a vaccine out that would be safe, effective, and used. So I think we're excited by that whole side. The challenge for us and desire would be, can that also help us on the animal side? Because there's far less of a market, but there's still a need for having vaccines that work in the animal population. So new technologies coming along, new platforms, new and faster registration processes. The excitement would be making that work, seeing that work for on the side of animal pathogens as well. The other thing that I think that really excites me is the concept that really detecting something new starts at home. It has to start with community level services. So the recognition that we have hundreds of millions of people who keep livestock, and their health is connected in part to their livestock. But their health services might be looking really at their human health side. The community health services will look at, whether they are taking their treatments, whether they're being, following up on their TB or whatever is in some of the countries, the real community health service focus. Can we extend that? Can we make a community one health service that connects these talking to people with the fact that they also keep animals? So we can build and sustain some of those community level services. Now, it doesn't sound very high tech, but actually it would be quite a difference in shift to say, let's use the new technologies of reaching people quickly through their phones, through other routes, to bring them into being part of the system. So I think the new possibilities there are to have a much more integrated approach, to train and scale up training very fast, using the new ways of reaching and involving through virtual learning, mobile-friendly training, so that we could respond much better and we could train people at scale, even global scale, faster than 100 days. In fact, we could probably do much faster than that. So that's using information technologies more than very specific, let's say, countermeasures. They're more the human population that must be involved if we're going to manage things quickly.
Excellent. What's coming up for 2023 in terms of public-facing initiatives? I know as I was sort of researching you in anticipation of the show, I noticed that you've been involved from different health summits, the quadripartite conference that was online. Talk a little bit about what's coming up, any other public-facing events, initiatives, conferences that you're going to be presenting at, where the public can see you, meet you potentially, and anything else that I did not touch on for 2023 as it pertains to FAO and specifically your mission. Please take the floor.
Yes, thank you. Well, I think as an organization, I mean, we are working, say, very closely with our quadripartite partners. So there's significant things happening. UN General Assembly will have a high-level meeting on pandemic prevention, and so not necessarily a chance to meet me, but it is an important time in which we say, how are our organizations working together in a multi-sectoral way to be able to manage these risks? So I think that's a significant event in this year. We also have the Food Systems Summit stock-taking moment. So this is what have we done over the last 2 years to make our food system more sustainable? Now, One Health is one part of that, because what we consume, where we consume it, how we produce it, they do have impacts on, for example, on our antimicrobial use, for example, or the likelihood that that product could be a source of infection, or even that it's driving the type of change, deforestation, or interface. So the Food System Stock-Taking Summit is saying, what are we doing on that side to make our food system more sustainable? How does that connect to our health? So a lot of focus has been, quite rightly, on pandemic prevention. We need to connect, and that's what we're trying to do this year in this work, is to say how we produce our food, the health of that production system. That's One Health, because it contributes to that. So those are the Food Systems Summit stock-taking is in early July, and the UN agencies, including FAO, are leading on that. We're also in this year handing in the quadripartite the presidency for 1 year to UNEP, UN Environment Programme.
Okay.
So we would expect that our discussions and our focus or shift in focus will be, how do we well implement the One Health contributions in the area of environment? So the way the land use decisions that we take, they affect the environment, and the environment affects our risk. So how are we integrating One Health with the environment ministries into our thinking? Because if we only build the public health system, but we keep creating risks on the side from the way that we keep animals. So that's going to be, one of the things working together is going to be looking at that. We have a joint plan of action for One Health, so we will be implementing that in as many countries as we have the opportunities to do so, using the different opportunities around the world which come out of the pandemic fund, for example. So the new pandemic fund has a call for proposals that actually comes out on the 3rd of March, and countries are invited to propose multi-sectoral proposals to strengthen their health system. So a major part of our work is going to be really country focused, supporting countries and regional proposals together with our UN partners. Antimicrobial resistance, we will have a partnership platform, global partnership platform for antimicrobial resistance. We should have our first meetings of that platform middle of this year. That is an opportunity for a whole range of stakeholders to get together and form themselves into action groups to really sort of do the things which they might be not able to do by themselves. So how do we create incentives for appropriate use, for example? How do we reduce the drivers for antimicrobials through reducing disease burdens? That's going to be an active platform and kicking off this year, for which we believe will really be one of the important motors for change. And so there'll be engagements from that. that might well develop further into possibly national platforms that will try to bring stakeholders together beyond the government level that we have at the moment, because many of these changes that are needed really needs private sector, civil society driving them forward at country level, if they're going to work. And that's sort of, the shift really to bring in private sector, civil society as partners to government at country level. So these are the types of things that we're pushing on. FAO's has a new initiative which is part of supporting the global antimicrobial action plan, and that's called Reduce the Need for Antimicrobials on Farm, Reno-Farm. And that initiative is there to really aims at reducing antimicrobial use by 30 to 50% in the next decade, shifting to appropriate use and safeguarding the supply. And that will focus on changes on farm to make every farm is part of the solution, and getting there will require those partnership platforms and so on to be able to help us. So those are kind of snapshot of our kind of major areas.
It's going to be a busy 2023, but I'm glad you're there, leading this and coordinating these important programs. Again, wishing you the best for all of this, because it's just as you mentioned, it's all connected, and per the mission of your organization, and in terms of not just defeating hunger, but proper food security around the globe. It's just
on top of that, I didn't mention, but of course, things like our global epidemic of avian influenza, they are also driving a whole new set of meetings this year, some of which will be, which absolutely will be public facing, because the public is asking a lot of questions about why is this killing wildlife? What is the risk to human population? Why are we not using more vaccines? Those things are really ones that we bring the experts together to convene their expert opinion. We also need to work with our partners to make these solutions more feasible and ensure that there is a supply chain of suitable vaccines. So all those things are part of our span of work.
Excellent. For everybody that is going to be listening to this particular episode of our show across the various podcast networks, or watching here on our YouTube channel, again, you've been listening to Dr. Keith Sumption, Chief Veterinary Officer and leader of the Animal Health Program, Food and Agriculture Organization of the United Nations, Director of their Joint Center for Zoonoses and Antimicrobial Resistance, doing really amazing work on disease ecology at the intersection of wildlife, domestic, and the environment. Keith, I want to thank you for taking the time out of your schedule to come educate us for a little while today. Obviously, thank you for everything you're doing there at FAO. And as we like to say on our show here, thanks for helping to create a better tomorrow for so many people out there via what you do. A really great story.
Thank you for the opportunity.